Thanks for taking time to join us today for our presentation about the SAGE program. My name is Nikki Kuchenmeister, and I am the follow-up coordinator here at the SAGE program.
And I'm Carly Koberstein. I'm our SAGE coordinator.
A little rundown of what to expect. First, we'll give the brief presentation that explains eligibility, covered services, required forms, form submission, follow-up, and billing. For a little background on the program, the SAGE program is a part of the national program with the goal of encouraging individuals who are eligible to access free breast and cervical cancer screening services. In 1990, Minnesota was one of only 4 states given a grant from the National Breast and Cervical Cancer Early Detection Program, the NBCCEDP, to develop a program to screen lower income, uninsured and underinsured individuals for breast and cervical cancer. The program came to be with the recognition by Congress that individuals who were uninsured or underinsured were able to access these life-saving services. Since 1991, we have screened over 176,000 individuals through SAGE. We've detected 3,100 breast cancers, 100 cervical cancers, and over 8,500 cervical precancers have been detected. Eligible patients can access breast and cervical cancer screening services through one of more than 400 screening clinics in almost all of Minnesota's 87 counties. Residents of Minnesota qualify for services through the program based on age, income, and family size and insurance status. To qualify for the SAGE program, certain eligibility criteria needs to be met. The SAGE program is for individuals who are Minnesota residents, ages 40 to 64 for breast cancer screening, and 30 to 64 for cervical cancer screening. Certain exceptions do exist for patients who are under the age of 40, so 30 to 39, if they have a concerning symptom for breast cancer, or if they have a strong family history, like breast cancer in a mother, daughter, or sister, would also be eligible. Individuals must have no insurance or have insurance that won't cover breast or cervical cancer screening or diagnostic services. This also includes having an unmet deductible or copay. And they must fall within the income and family size guidelines. Individuals need to be under 250% of federal poverty level based on family size. Income is self-reported and no documentation is required. Family size is based on the total number of people supported by the family income. Self-employed individuals or farmers may take their income after business expenses have been removed. The NBCCEDP funds a program in every state, the District of Columbia, 6 U.S. territories, and 13 American Indian and Alaska Native tribes or tribal organizations. Each funded entity has its own unique name for their program, and each state has determined its program eligibility. As a result, only Minnesotans should be screened through the SAGE program, and non-Minnesota residents should be referred to their local program. In some circumstances, we can also serve patients who reside just across the border in Wisconsin, North Dakota, South Dakota, and Iowa. However, people with a Minnesota address would not be eligible for MABC treatment resource. If they were to find they had breast cancer or cervical cancer, We can talk more about this if you have patients that live across in the border states too, to see if they're eligible. Just reach out to us. The SAGE program is for Minnesota residents who are uninsured or underinsured. While uninsured is pretty self-explanatory, underinsured is more confusing. Generally, patients are considered underinsured if they have an unmet deductible with their insurance, do not have coverage for screening services, have excessive copays. Are underinsured also applies to individuals that have coverage for their screening tests through their insurance, but have an unmet deductible that they may need to complete with diagnostic services. SAGE may be an option for that patient. Also note that individuals on medical assistance typically do not need the program and do not qualify for SAGE. SAGE is for individuals who are lower income. The income guidelines for SAGE are based on 250% of federal poverty level and is changed yearly. The program normally updates the income guidelines in early February after we receive a notice of the new federal poverty level rates. You do not need to verify a patient's income. The patient needs to report their income and family size on the form, and if the numbers fit within the SAGE guidelines, then they would qualify. Patients who are self-employed or farmers should take out their business expenses before reporting their income. Here's an example of our 2025 guidelines that are updated, and they're updated on our website as well. SAGE follows the federal poverty guidelines, and these guidelines again are adjusted annually. All right, Carly.
All right, thanks, Nikki.
Mhm.
So individuals who are due for breast and cervical cancer screening and fit the eligibility criteria qualify for services through SAGE. The SAGE program will cover an office visit with breast health education, with or without a clinical breast exam, although we always suggest a CBE. It's just not required at this point anymore. We also cover a screening mammogram and pap smear and HPV test if the patients do. And just to note that all SAGE services are free to the eligible SAGE enrolled patients. For patients with abnormal cancer screening results, SAGE will cover most diagnostic services, including all the ones shown here. And if you ever have questions regarding whether a service is covered, feel free to reach out to any one of us, and we can definitely help. Also note that while most individuals who had diagnostic services also had their screening services through SAGE, this is not a requirement. So as long as you have documentation of an abnormality and the patient qualifies for SAGE, they can be enrolled for just the diagnostic workup portion. Okay, so services that can be covered by SAGE are limited to breast and cervical cancer screening and diagnostics. Patients accessing SAGE services may be individuals who have not had much access to medical care, and they may request additional tests, or a provider may suggest additional testing. Please just note that SAGE cannot cover any unrelated services. So if additional tests are requested, please ensure that the patient is aware that they would be made responsible for all those additional costs and willing to accept those charges. If uncovered services are ordered by a provider without a patient agreeing to this, the clinic would bear responsibility for the bill. Okay, so now we'll talk about determining eligibility. So individuals can find out if they qualify for services through SAGE by one of two ways, either at your clinic or through our SAGE phone center. So if a patient comes into your clinic and you believe they may be eligible for SAGE services, it's the clinic's responsibility to verify patient eligibility either before or while they're filling out the SAGE enrollment form. Providers must not charge enrolled patients for SAGE covered services. If a clinic registers a patient into SAGE, but they're not deemed eligible by SAGE staff once we enter the paperwork in our system, the clinic would be responsible for any patient bill. The second way individuals can learn if they qualify for SAGE is by calling our SAGE phone center. When they do that, SAGE staff will answer and review the individual's eligibility criteria and then work with them to determine which SAGE site they want to make an appointment at. They'll then have a three-way call between the clinic, the patient, and our SAGE staff, and the patient will be warm transferred to the clinic scheduling line to schedule their appointment. Okay, so now we'll talk about some forms. So an individual who is eligible for services through SAGE must complete a SAGE enrollment form. And in addition to that, patients who are having a mammogram need the SAGE imaging summary form. And those having a pap smear would need the SAGE pap summary form. All SAGE services for a patient are linked together using a SAGE encounter number. And this encounter number is required to connect all SAGE visits to a particular patient. The encounter numbers start with 3 letters followed by numbers, and the letter code is unique to your clinic. And each time a patient has a new episode of care for SAGE services, they would need a new encounter number. There's one kind of exception for this. If a patient's getting a colposcopy, they would require a new encounter number. That would be different from that enrollment and pap summary form. Okay, and then we'll talk about the enrollment form first. This form is completed by the SAGE eligible patient at each office visit. The patient completes pages 1, 2, and 3 and signs page 1. We definitely need the signature on page 1. This lets us make sure we have their consent for the program. Information on page 2 is critical to determining their eligibility for SAGE services, and that has things like their age, address, income, family size, and insurance status. Then the clinician, nurse, or clinic staff completes page 4, which is the SAGE visit summary. And this has details about the patient's office visit, including any exam results and services that were ordered or done. And then the patient's unique encounter code is added to the top of the first and last pages. And we just like to make a note that it's good to review the enrollment form, making sure it's completely filled out and signed by the patient before submitting to SAGE, just to make sure there's no delay in payment on our side. And I can actually pull up the enrollment form if that would be helpful, just to kind of run through it quickly. I'm going to stop sharing for a second. Okay, so hopefully you'll be able to see this. I can make it a little bit bigger here. So this is the enrollment form, the first page. Like I mentioned, you'll put the sticky encounter label on the first and the fourth page. So this on the first page is where they will have to sign and print their name, include their date of birth and date of their appointment. The second page is really important. Like we mentioned, this lets us determine eligibility. Social Security number is optional. It's great to have all of this information filled out. This top portion, if they're Hispanic or Latino, is good information. Their race is good information. It's not necessarily required, but important. Number 17 and down is very important for eligibility. So if they have any health insurance, we need that listed here. How many people are in their household, their income. So that's very important. Page 3 is more health history information that the patient will fill out. So that's great to have. And then I'll pass it to Nikki if you'd like to talk about the visit summary a little bit more in detail.
Okay, sorry about that. Yes, I will talk about the visit summary. So this is a form that is frequently things are missed. So it is really important that this is filled out as well. So I will just go through everything on the form quickly, hopefully. Um, you'll notice at the very top, there's two boxes, Sage and Sage Plus. Since your sites do not do Sage Plus, you could check Sage if you want, but if you leave it blank, that's okay. A lot of clinics like to put a label, maybe like their visit label, where the name, chart number, visit date is, because it may have that information. And I think typically Hennepin does do that. But if you want, you can either handwrite it or put a label there. There needs to be a Sage encounter number on the back, or just copied over via hand, whatever. Underneath that information, there is the patient vitals, and that information is helpful, but not required. So if certain vitals aren't done, that's okay, as long as if you do have them, it is helpful. Thank you. And then under the next little section here, under patient history, this again is not a required section to be filled out. It is just helpful information for us to report back to the CDC about how frequently people are coming back in and getting screened. But it is not required. In bold text, there's a little section that says breast cancer risk assessment. If one was done on the patient, just note what your findings. But if not, it's okay again to leave blank. The next section is for the services that are provided at the clinic, and these are probably the most vital boxes to check on this form. The very kind of tiny top line talks about results counseling only, and that is would be when you bring a patient back in for to go over abnormal test results, be it a screening test or a diagnostic test. If you want to bring that patient in and have a discussion with them about the results. So either breast abnormality or cervical abnormality, and it has to be after a screening visit. The next section talks about the breast care services. Does the patient report breast symptoms, and does the patient have a family history? These boxes are really important to be checked if you have a client that is, 30 to 39 for breast issues, because we need to know if, why you've enrolled a patient that's younger than 40. At this time, I will just note at this time we don't, we can't enroll patients that are under 30, but if you have a 20-year-old that needs to be seen, please let us know and we can see if we can try to help that patient out. Under the clinical breast exam, we're just looking for if one was done at the visit and then the result, or if one wasn't done or if the patient refused. On the right-hand side of that box, there is, did you order an ultrasound at that visit, or was a mammogram ordered or done at that visit? All right, and now we're getting into the cervical services. For PAP services, these are really important boxes to pay attention to. If you have a patient coming back for a PAP, that's a routine screening, you can check the top box. The second box, the surveillance PAP prior to an prior abnormal. This is a box that's really helpful if you have a patient that's coming back more frequently than what we cover. Because if you have a patient that's coming in more frequently, we need to know that why it was done, or we may not be able to cover it. If the patient has had normals and there's no it's not because of a prior abnormal. If you do the primary HPVs, you can note that here. And then in the next little silo, the box over, it talks about the HPV services. It's helpful for us to know if it's co-testing and reflex. Again, that helps us with the periodicity of the PAP if we can cover it. So if they have the reflex testing, they can come in every 3 years, co-testing every 5. The next 2 boxes over are dealing with colposcopy, if you have that at your site. We're just looking to see, what was done, if any pathologies were sent, and then the reasoning. The far right box is why that colposcopy was done, if it was done for an abnormal PAP finding or if it was done for surveillance. I do like to note that underneath that, there's a little tiny line that says that we do cover endometrial biopsies in the cases of glandular or endometrial cell findings on a woman over 40 on her SAGE PAP. We can cover those, but not for postmenopausal bleeding. There's a bold little risk assessment thing. If you fill that out, it's okay. If not, that's okay too. And then if you have any comments that can help us with the form, that's where you would put them in the little comment section. All right. Thanks, Carly.
Yeah, thanks, Nikki. I will bring up our slideshow again.
Sounds good.
Okay, are you able to see that now?
Yes.
Okay, great. All right, so we will continue on with our forms. So next we have the PAP summary form. So when a PAP smear is completed on a SAGE patient, this form should be sent to the lab with the PAP specimen. The lab will complete this form and send it to SAGE, as well as sending your clinic the usual PAP results report. And this sheet also needs to include the patient's encounter number. We have to receive this form from the lab or your clinic in order to track the patient's results and to pay for the service. And if a patient has an abnormal result, SAGE will request outcome information, which Nikki will talk about in a little bit. So next, we have the imaging summary form. So when a mammogram is ordered on a SAGE patient, this form should be sent over for their mammogram appointment. It can be faxed or emailed over with their order. And then the radiology department will complete this form and send it to SAGE, as well as sending your clinic the usual narrative mammogram report. And this sheet also needs to include the patient's encounter number. We have to receive this form from the radiology department or your clinic in order to track the patient's results and to pay for the service. And if there are any abnormals or assessment incomplete, SAGE will request outcome information once again. Okay, so then kind of how do we handle all the paperwork? So after a SAGE patient has completed their office visit, the completed enrollment form should be reviewed in the clinic, making sure everything is complete and accurate and that the first page is signed by the patient. The form should be copied and the copy should be retained for your records. And then you can submit the forms to SAGE either by sending it in a secure email to the email address on the screen or by fax. It's also good to ensure that your billing system is aware that the patient is on SAGE and has their SAGE encounter number on record. If you ever need to order new encounter labels, you can go to this link here, and we'll share these slides after the presentation. You can order encounter labels there, and we'll mail them to your clinic. You can also go to that webpage and download and print new forms. And we have forms available in English and Spanish. And I will pass it to Nikki. Talk about follow-up.
All right. Can you hear me, Carly?
Yep.
Okay. I just want to make sure it was on. All right. So anytime a patient is screened through our program for breast or cervical cancers, abnormal findings are just a part of the normal process. So my job is to ensure that patients receive the high quality diagnostic services as well as access to treatment, and ensure they start treatment if they get diagnosed through our program. One vital thing about enrolling in our program is it gives the patient access to the MABC program, which is our treatment resource. It stands for Medical Assistance for Breast and Cervical Cancer. And if the patient is diagnosed with a breast or cervical cancer or a cervical dysplasia that needs treatment, they have access to the treatment resource if they are uninsured or have no creditable insurance, are under 65 and need treatment, and then are Minnesota resident. They can get access to the MABC program. There's more information and a webinar that we did, as well as we're having a webinar coming up about the MABC program. But we do have the webinar out on our website too if you want to watch it or want more information about it. Also, there's information about follow-up on our webpage as well. All right. This is the abnormal follow-up form. These get sent out to your clinical contacts, and what happens is when we get a result here in SAGE, it gets entered into our system, and then it triggers tracking. And so I will create the form here at SAGE, and then I send it out to your clinical contacts, and they fill it out and return it to me with the completed follow-up that was done. The form is sent out with the patient's name and information that we have on the top, the middle, the kind of top middle part is talking about why you're getting the form. So this is the breast abnormal form. So it will show you what was abnormal and why you're getting that form. The middle section, what we're looking for are the dates that they had their diagnostic workup done, and then the results if you have them. If you're having trouble getting them in at all, please, in the status, which is underneath that section, please make sure that you check incomplete and let me know if you want me to try to get the patient in, because we can help after, if like say you have deemed them lost to follow-up, we can try to help and give them a call and try to get them in to complete their care. If their care is complete, that's great. We'd want to know that. And then when they need to come back in. If they've transferred care elsewhere, that's really helpful for us so we know where to reach out for records. And then if there are any comments that you want to add, you can add them in the comment section, and then that form gets returned to me. If you have a patient that is diagnosed with breast cancer and needs treatment, please reach out to me or have the patient reach out to me to see if they're eligible for the MABC program. And I think Ricky does a lot of the MABCs too, so for Hennepin. So she might be the person there, your contact there to reach out to. All right, on to the cervical form. This form is similar to the other form. It gets sent to your clinical contact. Basically, it'll have the patient's information at the top of the form. Patients can either be enrolled at the point of PAP, colposcopy, or both. So you can either have them, this form may have different things on it. It may have just the PAP and HPV results, or it may have a date for the colposcopy. We're just looking to get the results of that colposcopy if they needed one done. If they had an endometrial biopsy, it's that kind of weird box on the right-hand side. And then in the lower section, they're looking to see what the follow-up recommendations are if they need treatment, basically. Those are the patients that may need MABC. So those patients, you can have them call me or Dr. Ricky or whatever. So the status of diagnostic workup, we're looking to see again if the patient's care is complete or incomplete. And if you're having issues getting a patient in, please feel free to let me know and I can try to help. We're looking to see when the patient needs to come back in for rescreening, and then again, if they've transferred care elsewhere. I think that's all I have for follow-up. And if you ever have any questions, please feel free to reach out to me. We're going to talk a little bit about billing, just some billing basics. Sage only accepts electronic claim submissions. Sage works with the Utah Health Information Network, or UHIN, for receiving claims or 837 files and sending electronic remittance advices, 835 files. Sage is currently not set up to receive and send claims status and response EDI files, 276s and 277s. To receive status on a claim, please call the Sage billing line or email Sage billing. Sage's timely filing limit is 120 days from the date of service. This means that Sage will need to have received the claims, patient's enrollment forms, and screening or diagnostic reports within 120 days from the date of service. Sage is the payer of the last resort, which means that the patient's insurance must be billed prior to billing Sage, including patients who have medical assistance serviced by a commercial payer, such as UCare. The only exception to this rule is if the patient has Indian Health Services as covered. Enrolled Sage patients should not be billed for Sage-covered services. Services not covered by Sage can be billed to the patient as long as they were made aware of their financial responsibility prior to services being rendered. Please reach out to the Sage billing team with any questions or concerns regarding claims or to check the claim status of submission. We have linked the Sage billing website that has a little bit more information. All right. Thank you for joining us today.
Thank you.
Thanks.